Working in public safety may increase the risk of exposure to these communicable diseases. Due to this, we want to make sure that your body has developed immunity to them. Being immune means that if you're exposed to a disease, your body has the ability to protect you from getting that particular illness. For example, a positive immunity to varicella, which is also known as chickenpox, it means that you're protected from getting that particular disease. This is shown by having a certain level of antibodies. In the case of hepatitis A and B, we can check the presence of the antibody. If it is present, then it means that you're immune to it. If it's not, then therefore you have no immunity to it. So what do we do when we don't have immunity? In this case, we may recommend that you get vaccinated. We use vaccinations to protect us from infections that can cause serious complications, serious illnesses, and even death in some cases. If you need any of these immunizations, we recommend to call and schedule with our case manager, or you can get your vaccination at your follow-up appointment. For varicella, we may recommend that you get 2 doses, 4 to 8 weeks apart. For hepatitis A, we recommend that you get 2 shots within 6 to 12 months apart. And then for hepatitis B, we recommend that you get 2 doses, 1 to 6 months apart. There are some cases where you may not be able to mount a response despite having those 2 full series of vaccinations. About an estimated of 5 to 15% of people may be in this category. These people are called non-responders. Sometimes this can be due to older age, perhaps obesity, smoking, and maybe other chronic illnesses. In this case, we recommend you are using universal precautions and just have closer monitoring of the disease. So now let's talk about tetanus immunization. Tetanus is caused by a toxin or poison caused by a certain bacteria. It can be acquired from bites, splinters, and even stepping on a nail. Tetanus has a fatality rate of about 10 to 20%. Therefore, it is very important to keep your vaccination up to date. We check the status of your vaccination by looking at the North Carolina immunization records. It is recommended that you get this vaccination every 10 years. Again, if you need vaccinations, this can be scheduled with our case manager, or you may get your vaccination at your follow-up appointment. The vaccination that we provide here is a combination one, Tdap, which includes diphtheria and pertussis.